There's nothing better than seeing a patient from a complex hip procedure that has given it all.
With a photograph or a story of them getting back to the things that they wanted to do.
This is what really keeps us going.
We see the common things, femoroacetabral impingement, labral tears, but also the more uncommon things, be that dysplasia or something even more complex on a daily basis.
The typical patient that we would see in the young hip clinic is an adolescent or a young adult with a hip problem, most commonly a result of a structural problem in their hip.
Patients with hip pain are unique in that it tends to affect many aspects and qualities of their life. The hip is what lets us get around and do our everyday things, but also to reach new athletic highs.
Patients that pursue hip preservation surgery for the hip dysplasia, they have half the risk of having arthritis and needing a hip replacement. A lot of patients come to Mayo Clinic because we're global leaders in hip preservation.
There's certain things that a clinician might see once in their lifetime or once in 10 years. Oftentimes the answer is, why don't we refer them to Mayo Clinic?
We're one of the highest volume hip preservation centers in the country.
Collecting the outcomes of our surgical procedures for 30 years. And that's very important because we can give patients advice so that they understand what to expect after their procedures.
Mayo Clinic is set apart in the fact that we have an integrated multidisciplinary care team that can provide tailored care for each individual patient.
We have orthopedic surgeons that come from different backgrounds.
Reviewing your protocol together during the same visit.
Being able to discuss concerns, questions with colleagues is very valuable to make sure that the patient gets the best treatment possible.
Another unique aspect of Mayo Clinic in that we do these combined visits with our physical therapists.
For example, our patients work with physical therapy before surgery so they can learn how to use crutches and how to follow their range of motion and weight-bearing restrictions, and that helps makes the recovery after surgery so much easier. Mayo Clinic is world-renowned for research and how we kind of push forward based on evidence-based medicine.
We're innovating and we're pioneering hip preservation. The Young Hip Clinic has some ultrasound experts here that do diagnostic and therapeutic injections.
We have the ability to print patient-specific 3D models, not only for patient education during clinic, but also help us plan, decide, and execute exactly what's the correct maneuver so we provide the appropriate coverage during a PAO surgery.
Coming to a center where a complex operation can be done swiftly and with a quick recovery is important for the overall outcome of the patient.
Whether you have something that's a more common diagnosis or a rare diagnosis, it's worthy to come to Mayo Clinic because you can get comprehensive care from a group that is invested not just in that patient in that moment, but also the long-term outcomes as well.
When patients come here for surgery, the whole team supports the patient before and after surgery. We work with you every step of the way to make sure that this experience is seamless and you feel safe when you're going home.